I'm going to tell you a story today about a patient of mine named Nikki. My name is Dr. Cameron Nyman, and I've been treating patients for the last 7 years. Lots of people recovering from auto accidents and all kinds of other conditions. So Nikki was actually a patient here with something called sciatica, and you can read her case study on our website. It actually helped her fully recover from this really nasty back pain. 5 months after that, unfortunately, Nikki and her son were in this terrible auto accident. So Nikki, the day of the accident, started having numbness in her hands and tingling and headaches and all kinds of crazy stuff, and actually went to the ER. They told her there that nothing was noticeably wrong and sent her home. But having trusted us and knowing that something was wrong, Nikki came to our office to get evaluated. What I'm going to show you here is Nikki's x-ray. So you'll notice on this side of the screen, this is what a normal person's neck would look like. So a normal neck has this sort of curvature in it, and that curve kind of acts like a spring. So that's how your spine spreads weight around, because your spine's main job essentially is to carry weight. If you look over here, you're going to see a spine that doesn't look like that normal spine. This is what Nikki's neck looked like after her car accident. When your neck gets 106.9% away from normal, this was due to whiplash that Nikki had suffered from. It starts to put pressure on all these joint surfaces that actually anatomically aren't meant to carry weight. So all of these crazy symptoms, numbness in her hands, tingling, weakness in her grip. And by the way, Nikki was a seamstress, so this was a massive problem for her. Couldn't work because she couldn't grip things. Headaches, neck pain, this sort of crazy feeling that she couldn't sit still without pain starting to escalate and just kind of elevate in her. So all these things, this was all due to the fact that her body now was carrying weight where it was not supposed to carry weight, which was on these joints here. There have actually been studies done that have shown people with conditions like this after a car accident can start to develop degeneration in their spine within 28 days. So in Nikki's case, she came to us right away. I mean, this accident was on like a Thursday, and I think we saw her Monday, so it was pretty quick. We actually considered Nikki in this case to be pretty lucky, because some people get into car accidents and think, phew, almost got hurt, or whatever, this kind of like got lucky, or ER told me I was fine, so I'm good to go. Those are the people who wind up here 3 months later, 6 months later, 5 years later with serious degenerative conditions. This is why we think it's so important for you out there to get checked out if you've had an auto accident in the last 12 months. Because with Nikki, we were able to get her on the fast track to recovery right away because she got in to get an evaluation.